Have you ever wondered how a simple pill can alleviate pain, fight infections, or even manage chronic conditions? The answer lies in the fascinating field of pharmacokinetics, the study of how our bodies interact with drugs over time. In essence, pharmacokinetics explores the journey of a drug within our system, from the moment it enters our body to its eventual elimination. Understanding this journey is crucial for developing effective and safe medications. This essay will delve into the 4 key processes of pharmacokinetics: absorption, distribution, metabolism, and excretion, often abbreviated as ADME. We will explore each step in detail, using simple language and relatable examples. By the end, you'll have a clear understanding of how pharmacokinetics plays a vital role in ensuring that drugs work as intended. Imagine swallowing a pill. The journey of that pill and the active drug within it begins with absorption. This is the process by which the drug enters our bloodstream from its site of administration, whether it be swallowed, injected, or applied to the skin. This journey isn't as straightforward as it seems. The drug must first dissolve and then cross various biological barriers, such as cell membranes and the lining of our digestive system. Factors like the drug's chemical properties, the formulation of the medication, pill, liquid, etc., and the individual's physiology can all influence the rate and extent of absorption. For instance, a drug taken with food might be absorbed slower than one taken on an empty stomach. This is because food can interfere with the drug's ability to dissolve and interact with the digestive system. Understanding these factors is crucial for determining the appropriate dosage and route of administration for a medication. Once a drug enters the bloodstream, it doesn't just passively float around. Instead, it embarks on a complex journey through the body, reaching various tissues and organs. This process is known as distribution. The bloodstream acts like a vast network of highways, carrying the drug to its intended destinations. However, not all tissues are created equal when it comes to drug distribution. Factors like blood flow, tissue permeability, and the drug's affinity for certain proteins can influence where the drug goes and how much reaches each site. Consider a drug intended to treat a brain infection. To be effective, the drug needs to cross the blood-brain barrier, a protective shield that separates the brain from the general circulation. This barrier is notoriously difficult for many drugs to cross, highlighting the importance of understanding distribution patterns when designing and administering medications. As the drug travels through the body, it encounters another crucial process: metabolism. This is the body's way of breaking down the drug into smaller, more easily eliminated molecules, often called metabolites. The liver, often referred to as the body's detoxification center, plays a primary role in this process. Think of metabolism as a recycling plant, breaking down complex substances into simpler components. Enzymes, the body's tiny chemical workers, are responsible for carrying out these metabolic reactions. However, metabolism isn't always about inactivation. Sometimes the metabolites produced can be more active or even toxic compared to the original drug. This highlights the importance of understanding how a drug is metabolized and what metabolites are formed. Section 5. Out with the old excretion. Eliminating the drug. After being absorbed, distributed, and metabolized, the drug, along with its metabolites, needs to be removed from the body. This final stage in the pharmacokinetic journey is called excretion. The kidneys, our body's filtration system, are the primary organs involved in excretion, filtering waste products and excess substances from the blood and excreting them in urine. However, drugs can also be eliminated through other routes, including feces, sweat, saliva, and even exhaled air. The rate of excretion is crucial in determining how long a drug's effects last. A drug with a slow excretion rate will remain in the body longer, potentially leading to a longer duration of action. Section 6. Factors influencing pharmacokinetics, a complex interplay. It's important to remember that pharmacokinetics isn't a one-size-fits-all process. Numerous factors can influence how our bodies handle drugs, leading to individual variations in drug response. These factors can be broadly categorized into asterisk physiological factors. Age, weight, genetics, pregnancy, and organ function can all influence drug absorption, distribution, metabolism, and excretion. For instance, infants and elderly individuals often have different drug metabolism rates compared to adults. Disease states. Certain diseases, particularly those affecting the liver or kidneys, can significantly alter drug pharmacokinetics. Liver disease, for example, can impair drug metabolism, leading to higher drug levels in the body. Drug-drug interactions. When multiple drugs are taken concurrently, they can interact with each other, affecting their pharmacokinetic profiles. These interactions can alter absorption, metabolism, or excretion, leading to either increased or decreased drug effects. Food-drug interactions. As mentioned earlier, food can sometimes interfere with drug absorption. For example, grapefruit juice is known to inhibit the metabolism of certain drugs, potentially leading to increased drug levels and side effects. Section 7. The significance of pharmacokinetics in medicine. Understanding pharmacokinetics is paramount in medicine for several reasons. Drug dosing and administration. By understanding a drug's pharmacokinetic profile, healthcare professionals can determine the appropriate dose, frequency, and route of administration to achieve the desired therapeutic effect while minimizing the risk of side effects. Personalized medicine. Pharmacokinetic principles are increasingly used to tailor drug therapy to individual patients based on their unique characteristics, such as genetic makeup and kidney function. This personalized approach aims to optimize drug efficacy and minimize adverse events. Drug development and research. Pharmacokinetics plays a critical role in the development of new drugs. By studying how the body handles a potential drug candidate, researchers can optimize its formulation, dosage, and administration to maximize its effectiveness and safety. Section 8. Pharmacokinetics in action. Real-world examples. Let's illustrate the importance of pharmacokinetics with a few real-world examples. Asterisk codeine and morphine. Codeine, a commonly prescribed pain reliever, is a prodrug, meaning it's inactive in its original form. It needs to be metabolized by the liver into morphine, the active pain-relieving compound. However, individuals with genetic variations in their liver enzymes might metabolize codeine poorly, leading to inadequate pain relief. Warfarin and vitamin K. Warfarin is a blood thinner used to prevent blood clots. It works by interfering with the action of vitamin K, which is essential for blood clotting. However, consuming large amounts of vitamin K-rich foods can counteract warfarin's effects, potentially increasing the risk of blood clots. Asterisk theophylline and asthma. Theophylline is a bronchodilator used to treat asthma. It has a narrow therapeutic index, meaning the effective dose is close to the toxic dose. Factors like smoking, age, and liver function can significantly affect theophylline levels in the body, requiring careful monitoring and dose adjustments. Section 9. Conclusion. Pharmacokinetics, a cornerstone of drug therapy. In conclusion, pharmacokinetics, the study of drug movement within the body, is a cornerstone of modern medicine. Understanding the four key processes of absorption, distribution, metabolism, and excretion, and how they are influenced by various factors, is crucial for the safe and effective use of medications. From determining appropriate drug doses to developing personalized therapies, pharmacokinetics plays a vital role in ensuring that drugs reach their targets at the right concentration and for the intended duration, ultimately leading to improved patient outcomes. As our understanding of pharmacokinetics continues to evolve, we can expect to see even more targeted and effective drug therapies in the future.